What should my newly 2-year-old be able to do when it comes to his or her speech and language? I'm Carrie, and I'm a pediatric speech language pathologist. Here is what I look for a child who has just turned 2 when it comes to their speech and language milestones. Can your child respond to his or her name and demonstrate joint attention? So if you say, look at this object, can your child look at that object and then look back to you? Is your child able to follow directions with a cue? Can you tell your child to throw the ball? Can you tell your child to go put it in the trash? Can you tell your child to clean up and put it in a bin? Is your 2-year-old able to understand hundreds of words? Can your 2-year-old identify basic pictures? Is your 2-year-old able to identify basic body parts like eyes, ears, mouth, nose? Is your child able to identify familiar clothes like shoes, socks, shirt, shorts? Is your child able to use 50 different words? That is the absolute minimum of words that I like to see a newly 2-year-old producing. So your child should be using at least 50 different words. Is your child able to label familiar pictures? Is your child able to label basic body parts and articles of clothing? Is your child able to label photographs? Is your child able to imitate simple hand gestures like clapping, waving, blowing a kiss? Is your child able to produce the following consonants? P, B, T, D, M, and N. Are those emerging in his or her speech? Is a stranger able to understand at least 50% of what your 2-year-old is saying in context? If you feel like your toddler is not meeting most of these milestones that I mentioned, I would highly recommend speech therapy. If you are unable to get speech therapy in your area, you are not alone. Follow along for tips and tricks to get your toddler talking.